Welcome to Interventional Radiology, part of the Diagnostic Imaging Center. This is where you will receive image-guided procedures using various modalities such as CT, ultrasound, MRI, and fluoroscopic scans. In this video, we will show how to care for your nephrostomy catheter. We will also address common issues or concerns, along with how to troubleshoot them. The hospital will provide you with a starter pack of cleaning supplies after your procedure. You will need to contact a medical supply store for refills of supplies. The supplies include liquid soap. This can be Hibiclens or unscented soap. 4 packages of 4-inch by 4-inch gauze pads. 1 optional package of 2-inch by 2-inch gauze. 4-inch cover roll tape, which is the Medipore cloth tape or Coviderm adhesive dressing. A resealable plastic bag to dispose of the old dressings and used supplies. And disposable gloves. You will also need warm tap water for the cleaning process. Your catheter supplies include a CTU-30 connecting tube, a bedside drainage bag for nighttime. An example is the Bard Bedside Drain Bag, 2,000 milliliters. A leg bag, for example, the Hollister Urinary Leg Bag Combination, Model 9348. And a Lure Lock cap. Your nephrostomy tube needs to be cleaned every other day or it becomes soiled. 7 to 10 days after your procedure, you may shower without covering the catheter only if the site is not red or does not have drainage. Use mild soap and water in the shower to clean the insertion site. Cover the site with a gauze pad after you dry off. Follow these instructions to clean your catheter. Wash your hands with soap and water. Gather your supplies and place them on a clean, dry surface. Put on a pair of gloves. Remove the old dressing while supporting the tubing. Throw the old dressing and gloves away in a resealable plastic bag. If you have stitches, look at the stitches to make sure they are still holding. Inspect the catheter insertion site and surrounding area for redness, warmth, swelling, drainage, or a bad odor. If any of these symptoms are present, or if your stitches are not intact, contact your healthcare team. If the tubing has a Lure lock, check the cap on the stopcock to make sure it is tight. Put on a new pair of clean gloves. Open 2 of the 4-inch by 4-inch gauze packages. Pour the liquid soap over the 2 pads in one of the packages. Next, pour warm tap water over 2 pads in the other package. Take out 1 gauze pad and clean the catheter site with the liquid soap. Work in a circular motion, moving from the catheter site outward. Repeat with the second gauze pad. Take out 1 gauze pad soaked with water. Using the same circular motion, clean the soap from the catheter site. Repeat with the second gauze pad. Discard all gauze pads in the resealable plastic bag. Pat the area dry with a clean 4-inch by 4-inch gauze pad. Place this gauze in the plastic bag. Place either a 2-inch by 2-inch gauze pad or a 4-inch by 4-inch gauze pad over the catheter site. If using a 4-inch by 4-inch pad, fold the pad in half. With the folded edge up, place it under the tube. Fold the other 4-inch by 4-inch pad the same way and place it over the tube with the folded edge down. Cover the gauze with a piece of the cover roll tape or Coviderm. Tape the catheter to the skin below the dressing, approximately 2.5 inches from the exit site. Check the tubing for kinks. If you have kinks, remove them. Take off the gloves and place them in the plastic bag and seal it. Place the bag in a trash can. Then, wash your hands with soap and water. Next, we will learn how to clean the bag. You need to empty and clean the bag daily. Use gloves when changing dressing, tubes, or bags. Replace bags at least once a month or more if an odor is present. Keep the drainage bag below your nephrostomy tube to prevent reflux or backup. Keep the drainage bag off the floor to prevent contamination. If you experience decreased fluid drainage or a pericatheter leak, there may be debris or a block in the catheter. To correct the problem, use a 10 cc syringe with saline to flush the tube. Be sure to flush with not too much force. If fluid is not draining properly, check the tubing for kinks. Call your doctor or interventional radiology if you have a fever greater than 100.4 degrees Fahrenheit, new or worsening pain or discomfort around the catheter site, redness, swelling, or warmth around the catheter site, large blood clots in your urine. The catheter is pulled out from the skin, cloudy urine with a strong odor, leaking around the catheter site, or a continued decrease in the drainage amount despite flushing attempts. Breakage or holes in the catheter, or the tube stops draining completely. Also, notify your care team if the tube stops draining completely or if your catheter is pulled out from the skin. If you have any questions or concerns, talk with your doctor or call interventional radiology at 713-563-7900.